Assalamu alaikum. Today we have the last lecture of carbohydrate metabolism and related disorders. Hypoglycemia. It can be defined as it is a condition when the plasma glucose concentration is less than 2.5 millimole per liter or 45 milligram per deciliter in a specimen collected into a tube containing an inhibitor of glycolysis such as fluoride oxalate. As the blood cells continue to metabolize glucose in vitro, hence low glucose concentration could be found in a specimen collected without such inhibitors, could dangerously misleading, causing what is known as pseudo-hypoglycemia. Symptoms of hypoglycemia may develop at higher concentrations if there has been a rapid fall from previously raised values, when adrenaline secretion is stimulated and may cause the known symptoms of hypoglycemia, sweating, tachycardia, and agitation. Cerebral metabolism depends on adequate supply of glucose from extracellular fluid, and other symptoms of hypoglycemia may resemble those of cerebral hypoxia, which are neuroglycopenia, including faintness, dizziness, or lethargy that may progress rapidly to coma, and if untreated, could result in permanent cerebral damage or death even may occur. Existing cerebral or cerebrovascular diseases may aggravate the clinical picture. Hypoglycemia, however, it is a disease manifestation and it is not a diagnosis for a disease. There is no completely satisfactory classification for its causes. One useful approach to divide hypoglycemia into either inappropriate hyperinsulinemia or appropriate hypoinsulinemia and reactive hypoglycemia, as summarized in this table. The hyperinsulinemic hypoglycemia, which is also known as inappropriate high insulin level, could be found in cases of pancreatic tumors as insulinoma, hyperplasia of the pancreatic islet cells, insulin receptors antibodies, autoimmune insulin syndrome, exogenous insulin intake, sulfonylureas, and meglitinides. The other hypoglycemia type, which is associated with hypoinsulinemia, could be related to endocrine abnormalities such as glucocorticoid deficiency, as in adrenal insufficiency, or severe hypothyroidism and hypopituitarism, or as a result of organ failure, as in severe liver diseases, end-stage renal disease, severe or in severe congestive heart failure, malaria, and some non-pancreatic islet cell tumors as insulin-like growth factors 2 secreting tumors, example liver, adrenal, or breast cancers, leukemias, and widespread metastases, lymphomas, and myeloma. The other or third type of hypoglycemia is the reactive hypoglycemia, which could be idiopathic or post-gastric surgery and alcohol-induced, in addition to other miscellaneous causes, such as von Gierke disease, which is type 1, glycogen storage disease, and administration of some drugs such as salicylates, quinines, haloperidol, and sulfonamides. The first type of hypoglycemia, the hypoinsulinemic type, which is associated with non-pancreatic tumors, non-islet cell tumors, although the carcinomas, especially of the liver, sarcomas, had been reported also to cause hypoglycemia, in addition to leukemia. The mechanism is not always clear, but Sometimes it could be due to secretion of insulin-like growth factor 2 or abnormal glycosylated big molecules of IGF-2. The IGF-2 acts to suppress growth hormone and IGF-1. Tumors secreting IGF-2 are characterized by increased plasma total ratio of IGF-2 to IGF-1 and low plasma insulin concentration. Endocrine causes of hypoglycemia could occur in cases of hypothyroidism, pituitary or adrenal insufficiency. However, it is rarely presenting manifestation in these conditions. Impaired liver function. Although the function of the liver is preserved for severe conditions, but despite that, its central role in maintaining plasma glucose concentration may be altered, result in hypoglycemia, which is a rare complication in cases of liver diseases unless it is severe and extensive. It may complicate very severe hepatitis and hypoxic liver diseases associated with congestive heart failure or liver necrosis if the whole liver is affected. In these cases, the plasma IGF-1 concentrations may be lowered. Also, conditions of renal failure could result in hypoglycemia, as the kidney, like the liver, is a gluconeogenic organ. The second type of hypoglycemia is the hyperinsulinemic hypoglycemia, where the insulin or other drugs are probably the most common causes, and it is most important to take careful of drug history in order to identify such conditions. Hypoglycemia in diabetic patients may be caused by accidental insulin overdosage or by changing insulin requirement or by failure to eat after insulin has been given. Similarly, sulfonylureas or meglitinides may also induce hypoglycemia, especially in elderly patients. Hypoglycemia due to exogenous insulin suppress insulin and C-peptide secretion. Therefore, measurement of plasma C-peptide concentrations may help to differentiate exogenous insulin administration from that endogenous insulin secretion when the plasma C-peptide is raised, or whether it is from an insulinoma or following pancreatic stimulation by sulfonylurea drugs. An insulinoma is usually a small, histologically benign primary tumor of the isocell of the pancreas. Third type, reactive hypoglycemia, or what is known also as functional hypoglycemia, can be seen in some people develop such symptoms of hypoglycemia between 2 and 4 hours after a meal or a glucose load, with a loss of consciousness could occur in rare conditions. Similar symptoms may follow gastrectomy or bariatric gastric banding. When rapid passage of glucose into the intestine and rapid absorption could stimulate excessive insulin secretion, lead to what is known as late dumping syndrome. Reactive hypoglycemia is usually an uncommon condition. Cases of alcohol-induced hypoglycemia can develop between 2 and 10 hours after the ingestion of large amounts of alcohol. It is found most in undernourished subjects and in chronic alcoholics, but also could occur in young subjects when they first drink alcohol. Hypoglycemia is probably caused by the suppression of gluconeogenesis during the metabolism of alcohol.